In this video, we will present the basic facts about dry eye disease. I will also present the most recent definition of dry eye disease. Let's start with some simple facts. Dry eye disease is a disorder that affects the entire surface of the eye and the tear film. The tear film is normally a healthy mixture of water, oil, mucus, and nutrients. The tear film covers the surface of the eye, keeping it moist, comfortable, and healthy. The tear film is very important for clear vision. In order to see well, your tear film must be stable and healthy. As you already know, dry eye disease can be associated with symptoms of ocular irritation, burning, foreign body sensation, and it causes blurred and fluctuating vision. People who have dry eye disease can experience excessive tearing. This happens when the eyes become very dry. For example, when outdoors in the wind, the sensitive nerve endings on the surface of the eye become irritated. This in turn will cause tearing and the eyes will feel wet. This can sound like a good thing, but the excessive tearing does not solve the underlying problem of dryness. People of all ages can experience dry eye symptoms, even children and young adults. Research has shown the prevalence of dry eye disease to be anywhere from 5% to more than 30% of adults. A recent Canadian study estimated that 21% of adults have dry eye symptoms. Unfortunately, dry eye disease is not always diagnosed correctly. Sometimes it is mistaken for other ocular conditions like allergies or infections. Dry eye disease is more common than most people think. As more research is being done, we now know that dry eye disease can have a substantial burden on a person's quality of life. We all know that dry eye disease can be an expensive disease. There are studies underway to estimate the financial burden of dry eye disease in Canada. Apart from the financial challenges, many people living with constant dry eye symptoms also experience emotional challenges such as anxiety and depression. We will discuss these aspects of dry eye disease in a later video. It is important to realize that most patients with dry eye disease do improve with medical treatment and a good dry eye self-care plan. Having a good understanding of your dry eye disease forms the solid foundation of your self-care plan. Next, let's define dry eye disease. In 2017, the International Dry Eye Workshop provided a comprehensive definition of dry eye disease. The workshop consisted of 150 experts from 23 countries who came together to review thousands of published articles on dry eye disease. The workshop defined dry eye disease as a multifactorial disease affecting the ocular surface. This means there are many factors that can produce dry eye symptoms, and it means not every patient with dry eye is the same. The workshop characterized dry eye as a loss of balance in the tear film. This means the amount of water, oil, mucus, and nutrients are out of balance. This leads to inflammation and tear film instability. Because the tear film is no longer healthy, the surface of the eye becomes inflamed and damaged. The nerve endings on the eye also become abnormal, causing pain, burning, foreign body sensation, and tearing. Dry eye symptoms can be mild, moderate, or severe, and symptoms can change over time. Dry eye disease management may involve any or all of the following: lifestyle and environmental modification, non-prescription drops, gels, ointments, and supplements, prescription medication. For more severe dryness, there are non-surgical and surgical procedures. Some people who have dry eye also have dry mouth symptoms. If your mouth is dry, be sure to mention it to your eye doctor, your family doctor, and your dentist. You may need to be tested for a condition called Sjogren's disease. Sjogren's disease is an autoimmune condition. The body's immune system attacks glands that produce tears and saliva. You can take this short questionnaire called the DEQ-5. If the score is higher than 12, you can talk to your doctor about testing for Sjogren's disease. To summarize, dry eye disease is an inflammatory disease in which the tear film evaporates too quickly or the tear production is too low, so the eyes dry out. People of all ages can suffer from dry eye disease. If left untreated, this condition can lead to pain, damage, or poor vision. Permanent loss of vision from dry eye is very uncommon. In the vast majority of cases, dry eye disease can be treated effectively. This is the reason why we have been asked to see you here at the Ivy Eye Institute Dry Eye Clinic at St. Joseph's Hospital. Dr. Mather will provide you and your doctor with a management plan to help keep your eyes as healthy as possible. Remember this important fact: managing dry eye disease depends on a good self-care plan. That means you need to understand your condition. In our next video, we want to give you a better understanding of why your eyes feel the way they do. With these videos, we hope to empower you to take better care of your eyes.